Essentially, we are living in the age of more and more data, and they're coming from more and more different data sources. You could think about Wikipedia or Reddit comments or even different hospitals providing hospital data. And when we think about all this data, usually we think the more the better. That's totally like what we're trying to aim for, collecting as much data as possible. But what we found in our research is that if you add data from a bunch of different sources, we find that the performance for a model might actually go down. That if you add data from, quote, bad sources or just different sources than the ones that you're looking for, you might actually hurt your model performance. And so the data addition dilemma is a framework that we came up with to try to weigh the cost and benefit of going to get another data source and incorporating it into your existing training data. Our inspiration for the data addition dilemma came from a lot of the different applications that my lab works on. So our lab has research on maternal health, it has research on climate health, it also has research on things like detecting if a patient will die in the intensive care unit. As one example, when we think about maternal health, oftentimes there's not that much data that is collected and that there's not that many people in one system, and therefore it's helpful to collect a lot of data and try to aggregate all the information. When we deal with really high stakes settings like maternal health that have existing racial disparities, that have concerns about different access to care and how different mothers might be affected, it is incredibly important that we make sure that the data that we use is high quality.